チーフメディカルオフィサー、またメディカルダイレクターでもございますドクターサルバトーレ・フェブラーロを紹介いたします。
こんにちは。Thank you, ladies and gentlemen, and thank you to the organizer of this conference, your API, your Osaka, for the excellent organization and their support. My presentation is focused on type of study. They think are very important because we're talking about treatment for patients, and obviously you have to start somewhere, and not usually the phase 1 study is a first type of study. I just want to introduce a new concept for the oncology study. So first, starting with a presentation, a slide showing two sides. One is a negative one, and it is like cancer is widespread. It's a global problem. There are in this very time now, many patients that are just finding out that they have a cancer, and a lot of them, they probably die, and a lot of them, they're living with the disease, and the family are affected. On the other side, if you look at the graph, and that's for the UK, you can see that the survival rate is improving, particularly for a certain type of tumor, and it's dramatically improved the survival. However, there are still some tumors, there are very important tumors like stomach cancer, lung cancer, where the improvement is not being so good. So there is scope for new treatment. And if we think about the drugs for cancer, traditionally the cancer has been treated with 3 types of activity. Surgery is still very important, radiotherapy, and then a cytotoxic drug, antimetabolite. These drugs, they tend to be very toxic, and with small index, and also they can cause cancer themselves later in life. And so that's, but fortunately now, the evidence is that with the new development in medicine, genetic, genomic, and there is a lot of new treatment becoming into the possible selection of drugs you can give to a patient. So I want to talk mainly about this type of drugs now. And the idea is that they're less cytotoxic, and they can spare the normal cells more than the older drugs. So this is just some of the mechanism that's been identified. And I won't go through all of that, but I'll just say, for instance, androgenic signal, that it's potentially good for dealing with the blood supply of the cancer. And the drugs that tend to be more selective. However, one still has to be careful because there can still be effect across the normal cells, like they found for the PI3K signal. So what's the role of healthy volunteers in oncology research? The possibility is now, because these drugs are not so toxic anymore, but some people think that healthy volunteers should be excluded from oncology research. In practice, that's not always the case, and there are some specific situations where probably using healthy volunteer is preferable and even more ethical. So I can tell you that many studies are already being conducted in healthy volunteers with oncology drugs. The one that classically been studied were the anti-hormonal type of drugs, but also the new cell cycle inhibitor, tyrosine kinase. They all already been studied in healthy volunteers. So the very first study is being conducted in healthy volunteers. So typically the phase 1 study in patients, they focus on identifying doses and safety and tolerability. They're very toxic and given to patients that really can be very seriously ill, perhaps at the end of their life. When you use healthy volunteer in practice, what you really gaining from conducting the study is characterizing the pharmacokinetic, perhaps the metabolic profiling. So all the aspects of pharmacology, they are really the foundation of treatment, can be very rapidly acquired in a healthy volunteer study. And that can help you for subsequent decision to get to dose selection when you actually move into the patient trials. And sometimes you can also identify a receptor occupancy or some proof of mechanism in healthy volunteers. So just to summarize what you really need as a doctor to treat patients, you need to understand it in the pharmacology. And so you need to try to understand those concentration, the concentration response. You want to understand the absorption, disposition, liver, kidney. So you can manage the drugs together with the other drugs and treatment the patient is going to receive. And really, for the pharmaceutical company point of view, it's about making some critical decision, go, no go decision in their development. There are obviously some regulatory consideration because when you treat healthy volunteers, they don't need, they have no medical benefit. And so as a population, they have a really different risk benefit. So you do need to do some additional kind of testing that typically is not done in phase 1 in oncology in terminal patients. So you do need to do some genotoxicity. That's to make sure that the drugs, they're not clustergenic, they don't damage the DNA. Because that's, if that was the case, you couldn't really give it to healthy volunteers. And also the starting dose is going to be different. You have to be more cautious with your starting dose. And this is a reference to, there is no specific guideline for healthy volunteers in oncology, but this is some regulatory consideration that they published. So I won't go in detail, but this is about just highlighting the importance of the first dose. There has to be a safe dose in the sense that you have a safety margin that you can take care of and manage. And there's two approaches. One is based on a non-observed at the event level, and another one is favored more recently. That is based on biological activity, and we also have to dose it has to be below what the minimum activity they can expect. That's not always possible to evaluate. So another concept type of study I want to discuss, put forward to you, is what they call really phase 0 study. It's a study in humans, and are really more properly kind of named as an exploratory study. And both the FDA and the EMA have a harmonized guidelines. So you can have an exploratory IND or an exploratory CTA, and they can be useful because you don't need the full range of preclinical assessment, but at the same time you have a limitation on the level of dose you need to give. But they're very good if you have more than one candidate, you want to select the best candidate for your subsequent program. Okay. So in conclusion, my message is that because of the new treatment in oncology, there is a possibility to evaluate this drug not only in cancer patients, but also in healthy volunteers. And there is an ethical aspect in the sense that patients that terminally ill, they wouldn't benefit from this first time into man administration of drug. At the same time, they have very high hope that something is going to happen, they're going to be cured. So sometimes it's not so ethical to dose these terminally ill patients in certain situations. So healthy volunteers can be considered, and I will be happy to discuss further with you if you have any questions or comments. So, dopo arigato, gozaimasu.